about your journey before becoming a psychiatric nurse practitioner?
Well, how many hours do you have? Because my journey has been a long one. Were you born in the United States?
Yes.
Okay, I'm sorry to ask you that, but I had to ask, a couple questions to just to kind of let you in
Okay.
from, what my background is. And did you also go to school here?
Mm-hmm.
Okay. In the course of your school days, were you able to take a school bus to school?
Yes.
Or your parent drop you in school?
Both.
Both? Okay. So, you see, for my journey, none of that went into play. So, I came from Nigeria, from South, Nigeria, where in my part of the world, people don't have the luxury of school bus. We didn't have the luxury of car. And I was not one of those kids that was able to be privileged to any of those things. So I went to school in an environment where you have to walk like miles on your foot to get to school. And there are people that were trekking like across cities to get to school. I was fortunate, however, because the school that I went to at the time was like a couple miles, 2 to 3 miles away from my house. So I would trek and go to school. And that was the beginning of my education year. And also, in the morning, you have to, of course, take your bath. Here, we just get into the shower. But then you have to go like miles away to go fetch water from the stream. And I would do that, fetch water from the stream, come back, take my bath. And because I come from a background where it was not easy. My parents, we didn't have the money, we didn't have the luxury, so I have to do what I needed to do to be able to survive. And one of those things was baking and cooking, baking like buns and stuff like that and taking it to school. So I will go to the stream, fetch water, take my bath, clean the compound, sweep, do all those things, bake these buns, take it to school with me so I can sell to provide things like buying my pen or buying something as simple as lotion. So I went through all that and going to school with that and I told you have all day, so you have to, I'm trying to tell you how I became the woman I am today, and I'm just going to go through the highlights, okay, because it's a long story. But the points that I'm trying to make is to establish how when you are determined to do something, you can become anything you want to be, and that's why I'm taking you through all those stories.
Okay.
So I went to school with one cloth. By that I mean one cloth, one dress. And in my school system, they have uniform and all that, but I could not afford a uniform. So I have this one dress that my uncle bought for me, and that's what I will wear from Monday to Friday to go to school. And I will come back from school, I'll wash it, and I'll hang it, and then I will wear it the next day. And when I say one, I'm not exaggerating. It was one dress. I did that through my elementary years, continue into my high school years. In high school, you're forced to have a uniform, so I have to have a uniform. So they managed to get me a uniform, and I wore that one uniform for 5 years. And I will wash it again every day when I come back from school, and I'll hang it, and I'll wear it the next day. I remember throughout my high school years, I only read one textbook that I actually was mine, and it was called Intensive English. That was the only textbook that I was provided with. Like, I actually own the whole of my schooling in Nigeria. But I had friends that maybe they have textbook. I will go hang out with them. I will read with them. I will stay in class. I'll make sure I don't miss class. I'll listen, and I'll try to remember everything because I don't have any other way of, doing or knowing the material besides listening. I was a pure science student. I love science. I love physics. I love chemistry. But I was in an environment that I'm studying physics without a lab. I'm studying chemistry without a lab.
Right.
And I remember like only one day that I was opportune to see a microscope, looking into a microscope once as a physics student. And I went through all that. And but there was one thing that was for sure in all of that. I had a vision. I had a purpose. I knew what I wanted to be. I knew that I have this dream that was so big. How I will accomplish it, I don't know. People were saying that, Blessing, you talk too much and you have too many dreams. How in the world are you going to accomplish it? I wanted to be a medical doctor. But how can I accomplish that with such a background that I'm just describing?
Right.
And so there was this motto that became my motto when I was in high school. It was aim high and study hard. And in class, I will continue to recite that. I will continue to, talk to myself, Blessing, aim high, study hard, aim high. So my classmates were making fun of me because I kept saying that, and it became my motto. It became a pathway that guided me to who I am today. So shortly after high school, I get involved with my husband at the time. The one that became my husband afterward. Now he's no longer my husband, but he was my husband then. And we had a child a year after high school. And we started growing our family, and things happened where I had to leave the country. So I went to a neighboring country, and we were there for 3.5 years, and things became even worse. So before that, backing up to my high school, it got so bad to when I needed to take my exit exam, because there's an exam you have to take before you can go to university. It's called WAEC, which is West African School Certificate Examination. Without that, you cannot go to university. So it was only 600 naira. That is an equivalent of 43 cents. And today, I could not afford it.
Wow.
I could not, my parents could not pay for that exam. I actually listened to help you navigate. So my job is simple. I just listen to you, help you navigate your emotion. If there is need for medication, I prescribe medication for you. If there's no need for medication, we talk through therapy. We talk to you. I help you build resilience. I provide you with the tools that you need to be able to cope with your emotion and for you to be able to have a mental wellness. So that's all I do. Just sit and listen.
Plain and simple. You heard it from her.
Simple.
So what are some of the biggest myths or misconceptions about seeing a psychiatric nurse?
People don't want to seek help because they feel the myth is that if you're going to a psychiatric nurse, that must mean that you're crazy.
That you're yeah.
People say you're crazy.
A minute.
Yeah, you're crazy. And that's a big myth because mental health is not because you're crazy.
Right.
It's not out of weakness it is not your fault that you have some neurotransmitter that is not balancing well. So that is a myth. And people also perceive mental health as a sign of weakness. Or in my country, they would say that, oh, that is a curse. It's something your parents or your generation have done, and the curse has come to you. And they allow them to roam on the street, eating from the dumpsters, because that is your curse, your curse. And over here, the stigma, around it, those are all myths. These are normal human beings that happen to find themselves in a situation where their neurotransmitters are not balanced. And so it creates all these symptoms. So they are not crazy. They are real people.
Right.
All they need is love. They need to be understood. They need to be careful. And they need to be allowed to be their authentic self.
I like that. Why do you think conversations about mental health are still difficult within the Black families and communities?
For the Black communities, there's a lot of stereotyping.
Yeah.
There's a lot of stigma within the Black, for the Black people. For African American or Black Africans or other minorities, there's a lot of stigma that surround mental illness. We are seen as people that we are strong enough to be strong and not be vulnerable.
Right.
If we try to, we come off like, oh, we have the tendency, they say we have the tendency to be aggressive. If we talk, they say, oh, speaking out of anger or frustration or hostile. We have those people labeled the Black communities with those type of labeling. They are angry people. They are hostile people. They But the one thing that we are not given the opportunity to be vulnerable. Okay, so Black Americans or Black African, they don't want to seek help because they are afraid to be labeled.
Right.
They are afraid to be judged. They don't want to be judged. So for that, we don't want to express our vulnerability because who knows what they're gonna say. And I remember there's a study that was done here in the U.S. in 2024 by the Department of Human Services. It said 36% of African American or the Black communities are less likely to receive mental health services.
Really?
Why is that? That is because we don't seek the help because we are afraid somebody's going to call us name. We are afraid somebody's going to say, oh, there they go again.
Right.
And so we keep that to ourselves. We don't want to talk about it. I remember, like, for me, I have this high voice and I talk with my hands. And I walk up in labor and say, you are aggressive. I'm like, oh, Jesus. I'm like, if people that know me will know the last thing that anybody can describe me is an aggressive woman.
Yeah.
And I've had my manager come to me and say, Blessing, you need to, keep your hands down when you talk because they're saying that you're aggressive. And I know for a fact that you laugh through everything and that is not you. And I was like, what do I do? Like,
Right.
how do I
change that?
Yeah. How do I change that? And then, for example, in my country, we are taught, especially when you're talking to an elder or somebody of authority, you don't look at them. Because looking at them is a sign of disrespect.
Really?
Yes. And then you come here, and if you don't make eye contact,
You're not paying attention.
no, you're not paying attention. You're either on drug or you have some level of substance in you, and you can look up, and we judge by that. Why this? But not knowing that this could be a cultural difference. This could be, for the fact that this is the culture. This is what this person is known to. And that is why at EMPATHRA, we decided that we are going to treat everybody based on who they are.
Right.
We're going to be very real, allow them to be their authentic self, and not judge them based on their social background, their ethnicity, the color of their skin, what they look like, what they stand for, their belief system, and all that. We decided we're going to treat everybody as who they are,
Right.
who they were created to be. So the Black communities have so many odds against them.
We do.
Because, we just have to break that odds. And my goal is that at some point in my life, I will be able to break that barrier and break that stigma, and so that everybody will have the liberty of seeking help if they need it.
Or even when you have somebody who wants to help, but they're like, they don't see my best interest, you will have those people, those nurse practitioners, those doctors who, oh yeah, let's just make some money off this one. We're not even going to give them the help they really need.
And that is really sad. And that is really sad because, talking about that, I had a client that came to me. I was seeing her last week. This client has been battling with mental health for over 40 years. And I was talking to her, and at the end of the section, she said, Blessing, in my 40 years of journey, and I'm talking about trying medication and all 9 years, nobody has really get me the way you did. And I said, that is why I'm here. This is my passion. I know people pay to seek help,
Right.
but I could make more money doing what I was doing than what I'm making now.
Right.
So it's not about the money.
Right.
It's far beyond that. When you can see the passion behind what you do, when you have the passion for the people, you have the heart for the people, you want to reach out to their soul, you want to connect with them,
Right.
and allow them to be vulnerable and say it is okay. You don't need to fear. You don't need to live by what people are using to define you. You are unique. You are yourself, and you are authentic. And at my clinic, at EMPATHRA, that's what we strive for. We want our clients to be authentic, to be their authentic self. And we provide that space that they can be vulnerable and be heard without judgment.
I feel like you're talking to me right now. I'm feeling it.
Okay.
Like,
Okay. And that's
I love it,
the
though.
message I want to get out there.
Yeah, for sure.
Okay.
I like that. So how can someone recognize when everyday stress has become something that deserves professional attention?
When you feel yourself in constant worries that has interfered with the way you function, you are not able to do the things that you enjoy doing. You are not able to get out of bed. You find yourself sleeping 12, 13 hours. You get up and you feel exhausted. You don't feel rested.
Right.
You are not able, you can't go, you don't like going out with friends, or you're having some emotional breakdown. You don't know why. People ask you, you're so tired, but you don't know, you can't figure out why you're tired. Or you cannot concentrate, or you cannot focus at your job or at school or whatever you're doing. Those are signs that you need to seek help. Because once your emotional state start to interfere with the functionality of your daily life, then that's a problem.
Right.
So you need to start seeing, when you start seeing that, or if you know somebody that is going through that, that is a time to start seeking for help. Because we don't want to wait until it becomes a crisis,
right,
before seeking for help. So those signs of anxiety, depression, persistent sadness, persistent constant worries, you can't eat, you sleep too much, or you don't sleep at all, or you look at yourself, you just feel miserable. Those are signs that you need to seek help, because there could be something that is, that is bigger, that is coming.
And it could get worse in a matter of seconds.
In a matter of,
How do psychiatric nurse practitioner and licensed therapists work together to provide that patient care?
We work in collaboration, because mental health is all about collaboration with other. We collaborate with therapists, we collaborate with the primary care doctors, but mostly with therapists, we collaborate because with therapy and medication, we can treat the whole being.
Right.
Most of the time, before we even offer medication, we like to offer therapy. Because if you have tools that will help you, there are modalities that are out there that will can help you to build those coping skills, build the resilience. So we work with them, and with the therapists, they provide those necessary tools in counseling and helping you. Like, if you're feeling anxiety, if you take a deep breath, take a second and take a deep breath, this will help. Or if you are feeling this, you do this. So they help with that. Why psychiatric nurse practitioner, we also do provide therapies, but we can prescribe medication in combination with therapy and help you. So we're treating a whole being instead of just the medication aspect of it. So we do work with therapists a lot, and we get a lot of referrals from therapists as well, and we send them clients as well.
Okay. Yeah. Which healthcare professionals are your ideal referral partners? Would it be therapists? Or
well, everybody. I think everybody is an ideal referral. Yes, everybody. Okay. Because you are in the room with that loved one that you see that is struggling. And you are also in the room with your friends. You hear them, you see how they are struggling. So that referral could come from you, could come from everyone. Mostly we get referrals too from primary care doctors, from therapists, from social workers. So we do get referrals from all of these people. But I do encourage people to be a source of referral to their friends, to their loved ones. Because what if there's somebody that they don't even go to the hospital? So how is the primary care doctor going to see them to refer them if they're having mental breakdown? So it is left for you as a loved one or as a friend. If you see something, you say something. So if you see a friend that is struggling, you encourage them. If you see a loved one that is struggling, you encourage them to seek help. But in this hospital setting, social workers do send referrals, doctors do send referrals, therapists do send referral, and even home health agencies do send referrals. So we get referral for, but my ideal referral is you. It's you.
Okay. And so what are some daily habits people can practice to improve their mental health before a crisis develops?
Prioritize your sleep. That's a big one, because sometimes we take sleep for granted.
We do.
But God has designed us in such a way that He allowed this body to work and created a time for it to rest. So it's not going into overdrive.
Right.
We change our oil to our car every now and then, right? To keep the engine going.
Right.
So that's what sleep does to our body. Sleep nourishes our body. Sleep helps our brain to regenerate those cells that we use all over throughout the day. So prioritizing sleep, making sure we are sleeping at least 7 to 8 hours a night is very important. Other things we could do also is becoming active, physical activity, exercise. 30 minutes. I know we don't have time, and I'm preaching to the choir here because I'm one of those that I say, I don't have time. Bless you, I don't have time. I'm going to be here, I'm going to be there. But we have to take care of our health. We have to sleep. We have to exercise. We have to do the things that we love to do. Go out with people. Enjoy. I'm not talking about parties and indulging in alcohol and all that. That's a different story. I'm talking about actually going out with people that means a lot to you. People that you love. Hang out with them. I took my son to the doctor office for his physical last week, and I was impressed because one of the 6 modalities of health that the doctor was talking to him about, do you call somebody every day? That was number 6. I was very impressed because now finally the society is realizing how important it is to have somebody you talk to every day.
I didn't know that was that important.
Yes, it's part of the 6 health modalities now. So picking that phone call, hey, how are you doing today?
Right.
Those are the things that we can do to stay healthy, to make sure that we are connecting with people that gives us joy, people that allow us to be who we are, people that we can trust, people that we can be vulnerable to. So to summarize that, sleep, exercise, meditate, call friends, eat healthy, and that will take care of your whole being. And if our mental state, if you're okay mentally, it takes care of the whole body as well. I always say mental health is an anchor to all the rest of your body.
Yeah, it matters.
It matters.
It really does.
Because if you're not in a good mental health state, you will not even take the medicine that will save your heart.
Right. Hello, say that again. Now everything just looks like what I need this for, what I need this for.
Exactly.
Because this up here is not functioning.
So if this is not functioning, that will not allow the rest of the body is going to suffer.
Yeah.
So we have to take our mental health seriously. We have to know that mental health is as serious as somebody having a heart attack. Yeah, that's how serious it is. Because if we are not mentally balanced, everything else, we can forget.
Falls apart.
Yeah.
So do you think that if you had a patient right here who was battling a mental health crisis and you had a patient right here who was battling a heart attack, which one would people run to first to help?
People will run to the one having a heart attack
first. Is it more physically?
Because people will run to that person first. Because if we both of us shows up to emergency room now and one person is having a heart attack, the other person is in mental health crisis, they will attend to the heart attack person first because if life is a danger. But one thing that I want to break and I want to let people to understand, I want people to start to think about mental health as serious as we are thinking about heart attack. Because if you don't take care of, if you have somebody that is in blown psychotic state, that person can equally kill themselves.
Right.
I have seen patients that hurt themselves in the hospital. I have seen patients that actually starve or cause staff to go into coma in the hospital. Because we think it's not as serious as a heart attack. It is. Okay? Because mental health breakdown is that serious. People that, like, remember when I said earlier, could you have imagined 11 minutes, 11 people dying every minute? How many minutes have we sat here?
Right.
And calculate how many people would have been dead from mental health.
Oh, that's body after body.
Yeah. So that's how serious it is. And I want people to take the two conditions as serious as they are. So if I'm having a heart attack, this person is having mental health crisis, I better have 2 doctors running or 2 providers running at the same time to save these 2 lives.
On both patients. Yeah.
Yes. None of them should be neglected. That's how serious it is.
Wow. So what advice would you give someone who's been silently struggling because they're afraid of being judged?
My advice would be, don't be afraid. Make that first move. That first phone call or office visit or telehealth visit could be a defining moment for you.
It could save your life.
It could save your life. I know fear is real. Judgment, people judge, people stereotype. But at the end of the day, this is your life we're talking about. So don't allow people to put that fear. Don't allow people to put you down. Take that courage to make that first phone call. Take that courage to seek that help, because that will help you. That will help your mental state. So people, I know, like we talked about, a lot of stigma, a lot of fear. People don't want to be vulnerable, but we have to take that first step to encourage ourselves and encourage our loved ones to seek help.
Gotcha. And then what legacy do you hope to leave through your work?
That's a good one. But I want to be remembered as that nurse practitioner that broke the stigma around mental health.
Amen.
I want to be remembered as that nurse practitioner that created awareness in the health system, that created an impact in the mental health world. I want to be remembered as that nurse practitioner that gave her space for people to be vulnerable, to people to be authentic about themselves. I want to be remembered as somebody that broke the barrier, the gap between mental health and wellness. So years down the road from now, I want people to be able to freely, without being afraid, to seek help. I want people to be freely, without being afraid, to say, oh, I am struggling with these challenges with mental health, and not afraid to seek help. I want to be that voice that will stand in the gap for the vulnerable people, for the people that are stereotyped, for the minorities, for the black communities. I want to be that voice. I want to be remembered for that. And that is the legacy I want to leave behind. It's not about the monetary gain.
Right.
It's not about what I stand to gain. It's about how I am going to be able to create an impact into the life of people. And that's all I want. That's all I want.
That's powerful. My last question for you would be, if every viewer remembered only one message from today's conversation, what would that be?
I want them to remember that Blessing has said, do not be afraid. You are not alone. There are millions of people out there that is struggling, the same struggle. You are not alone. And we are here. EMPATHRA Mental Health and Wellness Center, we are open. Our doors are open. We are here to walk this life with you. We are here to allow you to be yourself. So don't allow people to call you crazy, because you are not. You are not weak. For anything, you are very courageous.
Yes.
And we will empower you. So that's the message I want to leave in the heart of people as we wrap up this session.
Well, thank you, Blessing, for coming on Legacy Lounge today and being part of our podcast. We thank you.
I thank you so much for having me, and I'm so thrilled for allowing me to, me to use this platform to reach out to people, and I'm very grateful for the opportunity that I didn't take it for granted.
Thank you.
Thank you so much.